we all know that the current situation in terms of public services, in terms of the financial position nationally, is one of a huge challenge. And so therefore how services are going to shape up, what's important, what strategically we should be thinking about, and how that translates into local plans beyond this year is really important to us. And we as a trust board and an organisation have spent some time thinking about what are the important areas of policy, of service development, what does it say in NHS England's forward view about how services are going to be provided. The triple integration challenge, so that's thinking about mental health and physical health, around primary care and hospital-based services, around social care and health care. How these things are going to look in the future have to be part of our thinking and preparation for our future plans. So as part of that thinking, the Trust Board have identified 5 areas that they think we as an organisation ought to be starting to think about and ought to be influencing the way we work this year, and certainly our plans as we move into the new year in 12 months' time. So the first of those areas is around what I'd call personalisation. So it's about the individual, the person who uses and accesses our services. They're going to be a very different type of interaction in the future in terms of empowerment of individuals, in terms of self-care, self-help and self-support, and the expectation that there is that people will start to take greater responsibility around their own personal health and needs, how they interact with the community and how the community supports individuals. So the second area will be about how we start to join up our thinking and work jointly and put together joint development with the third sector will be another influencing factor on how we work going forward. So one of the greatest changes I think that has started to be identified by the public, by politicians, by NHS England is that primary care must reform. That initial entry point, that gateway of entry into healthcare has got to start operating very differently. The future looks different in terms of access to and availability of GPs, making primary care 24/7. So how we as a community-based organisation work closely with primary care in different models of working, in different solutions for those individuals with chronic and long-term needs, supporting them in their own home and keeping them out of hospital will be part of our focus going forward. So the fourth area that we've talked about as a board is how we work with our public sector partners. So I'm thinking about social care, adult and children's, I'm thinking about Airedale Hospital Trust, I'm thinking about Bradford Teaching Hospitals Trust, and I'm thinking about wider networks across West Yorkshire, whether that be mental health networks or community health networks, then how we work with the statutory sector in providing different pathways and models of care has to be part of our thinking also. So the final area that Trust Board thought was really important to start influencing our plans going forward was around digital technology and digital healthcare, and just trying to think about the service user of the future and how savvy they will be in terms of access to remote working, in terms of thinking differently about instantaneous information, about where and how they seek advice, about how they set up social networks and talk with others about health and healthcare needs. So we as an organisation have got to respond to that and start thinking very differently about the provision of services in a digital age